Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Well, Tracy, fall is here. The leaves are changing, at least here in Minnesota, and that means winter is coming. And, of course, that means that flu season is not far behind. Getting an annual flu vaccination is the first and the best way to protect yourself and your family from the flu.
This year, the American Academy of Pediatrics recommends that children aged 6 months and older should receive the flu vaccine by an injection this flu season, and they should not get the nasal flu spray because it doesn't provide enough protection against the virus.
Just not as effective. Ooh, that's tough, though, isn't it, for a kid? That nasal spray was pretty nice. Well, here to discuss these recommendations and other tips for flu season is Pediatrician Dr. Robert Jacobson. Welcome back to the program, Dr. Jacobson. Good to have you.
Thank you for having me. I appreciate it. This is an important time for parents to not only reassess for going back to school if their children are up to date on their vaccines, but also to plan for preventing the flu vaccine by making sure everyone in the family gets the flu vaccine.
Do we know anything about the flu season this year? Any predictions?
It's always hard to predict. I would say that if you've seen one flu season, you've seen one flu season. We have some changes with the recommendations this year. One of the changes made by the Food and Drug Administration as to how we should concoct the vaccines actually should lead to better protection. And we aren't predicting big changes in what will be circulating this year as compared to last year, so we expect better protection this year than last year with the vaccine we're using.
But it's a guess, right? It's always a guess.
I'll say it's an estimate. We have
an educated guess.
Yeah, okay.
We have data from that really we started accumulating in the winter before, and by February we have enough information about what is circulating in China and what we can expect to see crossing the globe and making it our way really 9-10 months later.
In some years, you're more successful than others, right?
That's right.
Yeah, well, hopefully this will be a successful year.
And let's talk about that FluMist that is no longer recommended. Why is that?
Up until the pandemic, study after study showed that the nasal spray flu vaccine, the live attenuated influenza vaccine, worked better in children than the injection form. And in fact, operating on that belief, we continued to recommend it and felt that it was as good or better than the injected form. But this year, in April and May, it became clear from studies available to the Advisory Committee on Immunization Practices and the American Academy of Pediatrics that in the last 2-3 years, the vaccine had not been working. In fact, it not working when the injection was working at 55-60%. So this is a problem, and this is why the Advisory Committee on Immunization Practices, that is the Federal Advisory Committee on Immunizations in both adults and children, have said no nasal spray for anyone this year.
I've told you this before, though. A couple of years ago when my kids got the FluMist, they both, the following season, went back to the shot because neither one of them liked the mist. So I guess you just can't call it, can you?
It is hard to predict what people will want and not want. I've had many a teen tell me they're not having anything sprayed up their nose.
Well, that's a good thing if they never let that happen.
That's true.
All right, so at 6 months is when we're saying that shot should be, that's unusual, isn't it? Has it always been that it's little bitty kids like that?
Actually, infants under 2 have hospitalization rates for the flu, for the infection, as high as those 65 years and older. And when that became apparent some years ago, we started routinely recommending the vaccine for those 6 months to 2 years of age. Then it was broadened to include toddlers and school-age children, then broadened to make it universal. Frankly, everyone benefits from getting the flu vaccine, and vaccinating school-age children actually is a great way for a community to reduce outbreaks in their community because it's the school-age children that bring it into the home.
It's that herd, what is it, immunity
herd
that you've
immunity.
talked about? Yeah.
Yes. I'd like to
Tracy,
create a
you've
herd
learned so much.
mentality
Yeah, herd
for everyone
mentality.
to get the vaccine. Now, that means a parent of a 2-month-old right now can't get their 2-month-old vaccinated, but they can make sure everyone else in the household is vaccinated. And 4 months from now, we'll still be vaccinating against the flu, and that's the time when that 6-month-older can get the 2 doses needed for the first time around getting the flu vaccine.
Well, of course, flu vaccine or not, we all want to know what we can do this winter to try and prevent getting the flu, getting exposed.
Well, it's hard to prevent getting exposed. If you live with other human beings, if your kids attend school, that's going to happen. But good hand washing is a great way to prevent viral exposures. And I particularly recommend hand washing with soap and water before meals, after using the restroom, while preparing foods, and of course after dealing with other people. Parents both can encourage their kids after daycare and after school to go into the bathroom, wash their hands with soap and water. Now, the vaccine, however, against the flu is the most important specific thing we can do to prevent the flu disease. And frankly, we just can't depend on good hand washing. Other measures to prevent viral illness would include getting a good night's sleep every night, and making sure that the sleep deprivation isn't wrecking your immunity temporarily.
What is the flu and what is not the flu? There's no stomach component, is there?
Well, it's funny that people use the phrase stomach flu all the time, but what we mean by the flu is a respiratory illness. That is one affecting the windpipes, the lungs, the nose and mouth. It can present with a sore throat or a cough and fever, and so many times children present for a rule-out strep throat. They're actually suffering from the flu, giving them a fever and sore throat. Similarly, children presenting with a cough and fever, striking the parent that this might be pneumonia, may be very well suffering a case from the flu.
Treatment. I know it's controversial, and the people that have discussed this before, and maybe even you, have said that, if you catch it early enough, there are medications that you can take, but it really only shortens the disease by 24 hours or something.
Yes, these medicines are problematic in that they have to be given right away at the beginning of the course of the illness, and in fact, on average, work to reduce the illness by a day. We'll use them routinely, without controversy, for every patient we're hospitalizing with the flu. If you're sick enough with the flu to go in the hospital, we will vaccinate. We vaccinate those. Oh, go ahead.
You said, I'm sorry, vaccinate.
I'm sorry. Use the antivirals.
Oh, okay.
Use the antivirals at the first sign if we're going to hospitalize. If the person's suffering from a chronic condition that puts them at high risk for the flu, we'll consider the antiviral. Again, if we can catch them in the first 2 days of the illness, or if we know they've been exposed, because these antivirals can also be used in people who don't respond well to the vaccine, such as immunocompromised, or those babies too young to get the vaccine but have been exposed. And there is a time frame where we can use the antivirals then as well.
And finally, what about the people who swear? They swear that they caught the flu from getting their flu shot. Is that possible?
No, it's not. You can't get the flu from the flu shot. And I'll tell you of an amazing study done at VA up in the Twin Cities. Here they had recruited hundreds of people, vets, 65 years and older, who agreed to do a very special study. Half of them were randomized to get the flu vaccine in the beginning of September and keep a diary for 2 weeks of every symptom they got the next 2 weeks. Half of them got saltwater injections, and the same thing. They didn't know whether they got the flu vaccine or saltwater, but they kept a diary for 2 weeks. Then everyone who got the flu vaccine came in 2 weeks later to get the saltwater vaccine. Didn't know it yet. They didn't know which one was which. Kept a diary for another 2 weeks. And the same went for the saltwater injectors. 2 weeks later, got the flu vaccine. And when they decoded the study and they looked at everyone's diaries, lo and behold, some people got as sick as a dog, the worst case of flu they've ever had. And there were equal percents in saltwater versus flu injection, and it was less than 1%. In fact, the only symptoms they could ascribe to the flu vaccine as compared to saltwater vaccine, whether you got first or second, was a sore red injection site that lasted a day or two and didn't interfere with going to work or enjoying the day. So no, the flu vaccine doesn't cause the flu.
What it means is that they already had the flu going when they got the flu?
I think, first of all, a lot of us call things the flu that we don't know if are the flu. It's actually very expensive to test where we have the flu, and in general, we only do that upon hospitalization or very special cases. more likely they caught some other respiratory illness that circulates in the fall. I mean, back to school means lots of new viruses and new exposures. And a lot of us came down with some sort of virus in the last month or so that we could probably blame on the back to school cycle. And that's when we give the flu vaccine. And that's why people tend to link getting the flu vaccine with getting sick. And that's just unfair.
I think we can truly say that you cannot get the flu from the flu vaccine.
You
That's
heard
right.
it here first.
Yes. And now you should believe it.
Now
That's
you know.
right.
All right, Dr. Robert Jacobson, pediatrician at the Mayo Clinic, talking about the flu vaccine. Thanks so much.